In this video, you'll learn how to bond an InBrace bracket using a single-tooth indirect bonding tray. The InBrace single-tooth indirect bonding tray is 3D printed with 3 different materials: a soft flexible inner layer, a clear rigid outer layer to improve seating of the tray, and pink resin is used to label the tooth number and case ID. A long axis indicator line is also added in pink to help guide the tray placement. In crowded situations, there may not be enough space to initially bond a bracket to its planned bracket position. The InBrace treatment instructions indicate when an offset bracket position or a blocked out tooth needs to be addressed after the fitting appointment. For a blocked out tooth, there are 3 different ways to create space, which are discussed in our other educational content. When sufficient space has been created, use the single-tooth indirect bonding tray provided in your InBrace fitting kit to accurately bond the bracket to its planned bracket position. If sufficient space has not been created, the single-tooth indirect bonding tray will not seat properly, resulting in poor bracket placement. So the first step of this process is to create and verify that there is enough space for the single-tooth indirect bonding tray to fully seat. To begin this process, prepare the tooth for bonding by creating space for the single-tooth indirect bonding tray by removing the smart wire from the brackets that are adjacent to the tooth being bonded. Clean the lingual surface of the tooth with pumice. Rinse and dry. To prevent cross-contamination, isolate the tooth with a tree retractor and cotton rolls. For patient safety, place a throat pack using an unfolded piece of 2x2 gauze. After the throat pack is in place, test fit the single-tooth indirect bonding tray to ensure full seating. If the tray does not fit, do not proceed with using the single-tooth indirect bonding tray, and evaluate to either wait until the next visit to see if enough space exists to use the single-tooth indirect bonding tray, or direct bond a bracket and fully engage the smart wire if space allows. If you choose to direct bond the bracket, at the patient's subsequent visit, evaluate the progress of tooth movement to determine if repositioning the bracket to its ideal location using the single-tooth indirect bonding tray is needed. Remember to remove the throat pack. If the tray fits in the test fit, then proceed with preparing the single-tooth indirect bonding tray by applying a very thin layer of primer to the bracket base and air thinning the primer using a dry air source, such as a tooth dryer. Next, use the adhesive fill guide to dispense the correct amount of adhesive and transfer the adhesive to the single-tooth indirect bonding tray. Make sure to cover 100% of the bracket base. Notice that the adhesive fill box for a single-tooth indirect bonding tray is marked in green. Return to preparing the tooth for bonding by etching the lingual surface for about 30 seconds. Rinse for 5 seconds and dry the tooth with a dry air source. Apply a thin layer of primer. Air thin the primer using a dry air source and light cure the primer for 5 seconds to complete the tooth preparation step. Light curing the primer is important because it reduces the possibility of tray tearing, which can minimize cleanup time. Place another throat pack using 2x2 gauze and then deliver the single-tooth indirect bonding tray, seating from the lingual and rolling to the buccal. Verify full seating of the tray and check that the long axis indicator line is centered. Adjust the position of the tray if needed. Once proper seating and positioning of the single-tooth indirect bonding tray has been verified, lightly hold the tray in place with your fingers and light cure for 5 seconds. Remove your fingers and light cure a second time for another 5 seconds. After light curing twice, remove the single-tooth indirect bonding tray, starting from the buccal and rolling towards the lingual. Then, fill any voids if needed. Perform a third and final light cure for 5 seconds to complete the indirect bonding process. If the single-tooth indirect bonding tray tore during the bonding process, then remove any residual or torn tray material at this time. If a reposition may be needed at a future appointment, submit an item request for a replacement tray. Post-bonding, check for and remove any flash and evaluate the bracket position relative to the adjacent brackets. If the bracket position appears correct, then proceed with ligating the smart wire. Here's a tip: apply free spray to a microbrush or Q-tip and press against the smart wire to soften it. This simplifies ligation of the smart wire to the single-tooth indirect bonded bracket. Now, let's talk about what can go wrong. The most common mistake is using the single-tooth indirect bonding tray prematurely when there is insufficient space for proper seating. So it's important to evaluate the bracket position after using a single-tooth indirect bonding tray. If the bracket position appears noticeably offset from the planned bracket position, then consider repositioning the bracket again by direct bonding and using the single-tooth indirect bonding tray in the following appointment when space conditions allow. However, if an offset bracket position due to an improperly seated indirect bonding tray was not repositioned and allowed to express, then the tooth will not move as planned. So the final and crucial step when using a single tooth indirect bonding tray is to check the progress of tooth movement at the next appointment and reposition the bracket again if needed. If repositioning is needed, evaluate the available space and reposition the bracket either by using the single tooth indirect bonding tray if there is now sufficient space for full seating, or by direct bonding if there is still insufficient space. This completes how to use a single tooth indirect bonding tray. Check out our other technique videos available on YouTube and on the Smile Design Studio at portal.inbrace.com.